Hi, so the question for today is a 47-year-old male was diagnosed to be positive for COVID 19. The patient dies of acute respiratory distress syndrome. On autopsy, sections from lung showed hyaline membrane. Interleukin 8 is the main cytokine implicated in the pathogenesis of ARDS. Interleukin 8 belongs to which chemokine? So, this chemokine is once again an important question. So, now let me go into uh, the chemokines, right? So if you see this question, there are a lot of information. So the question is about ARDS, and they have described the histology of ARDS. This again is an important question. So in acute respiratory distress syndrome, you have formation of hyaline membrane. Okay, and one other important question is the main cytokine implicated in ARDS is interleukin 8. Now, to which category does this interleukin 8 belong to? So what are chemokines? First, let's know what are chemokines. So chemokines are nothing but chemical substances which are going to attract your leukocytes. So you have different types of chemokines: alpha chemokine, beta chemokine, gamma chemokine, and CX3C chemokine, right? So they have different names. Alpha chemokine is otherwise called CXC chemokine. Beta chemokine is called CC chemokine. Gamma chemokine is called C chemokine. What does all these represent? So C is for cysteine. So when you have two cysteine residues separated by one amino acid, we call it as CXC C cytokine. So this X represents the number of amino acid. So when I say CX3C, it means you have two cysteine residues separated by 3 amino acid. So now let's look what all cytokines come under different categories. So interleukin 8 comes under alpha chemokine, and this is the one which is going to recruit your neutrophils. Okay. Under beta chemokines you have 3. Remember REM, R-E-M. Okay. R is for rantes, regulated and normal T cell expressed and suppressed. Then you have etoxin. Then you have MCP. MCP is monocyte chemoattractant protein. So what does this beta chemokine do? It recruits all leukocytes except neutrophils. So your etoxin is going to attract your eosinophils. Your MCP is going to attract your monocyte. Then coming to gamma chemokine. So gamma chemokine has only one, which we call it as lymphotactin. So that's going to attract your lymphocytes. Whereas CX3C chemokine, you have fructalkine. So fructalkine is going to recruit your monocytes as well as T lymphocytes. So this is in short about your chemokines. So great things are done by a series of small things brought together. So spend few minutes watching the video. Thank you.